When those sniffles and sneezes start creeping their way into your child's life, you'll want to do everything in your power to help the cold go away. For many parents, giving their child some cough syrup is an obvious first reaction. Cough syrup can be really helpful for helping get rid of your child's cold, but it can also be terrible for your child's teeth. That's because cough syrup can cause cavities. That's right, you may not think about it at first, but it does make sense. Most cough syrups have a high acidity level to help combat viruses and other infection, which can do damage to the tooth enamel. They can also be loaded down with lots of sugar to make the syrup taste better, and we all know that does not help with cavities. But what is a parent to do? Colds are a nuisance, but you also want to make sure that your child's teeth are healthy. Fortunately, there are some ways you can intelligently use cough syrup that can make any possible damage less likely. The first example would be making sure that your child does not take the medication before bedtime. Bedtime is when your saliva flows less than normal, and that decreased saliva flow would mean the sugary and acidy syrup would sit on your child's teeth all night long. If absolutely necessary, though, you can still take the syrup before bedtime, but you need to make sure to adequately wash your child's mouth before going to sleep. It's not ideal, but it's still better than completely letting the syrup sit. A second example would be to take the cough syrup along with a meal. When you're eating, your saliva is flowing more than it normally does. That means the saliva, along with the food and water, can help wash away the syrupy residue. Finally, if completely necessary, you should consider talking to your child's dentist about the possibility of your child using a topical fluoride. With these tips, cough season doesn't stand a chance, and you won't have to worry about your child's dental care.